Hi, you guys. Welcome back for our daily practice questions. As always, you know I like to get into our introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review books, review courses, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, y'all, assisting nurses and nurse practitioners internationally with exam success. I would love to work with you as well. Now, you know, I always get into my disclaimer and reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions you see here, I have designed and created based on what is currently being tested on the ANCC as well as AAMP exam. Now, any of the videos that I do that you may see that I am teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into our questions for today. All right, so y'all know on July 13th, I will be hosting my practice question course. It is, again, July 13th from 10 a.m. to 11:30 a.m. Eastern Standard Time. Now, what I will be doing, I'll be providing you guys with the breakdown, the exam breakdown for the ANCC as well as AAMP exam for family and adult Gero reviewers. So y'all know the blueprint, y'all know the layout, y'all have me explaining what it means in each one of those categories. We'll work through live practice questions. I will address how to approach and answer each question types, provide you with test taking tips, and we'll also have a Q&A session. This is $49. The link is in the description and the comments. If you want to join, we have 7 more spaces available, and I would love to have you. All right, let's get into our questions for today. Question number 1 states, a patient presents to the office today stating that she hasn't felt well since returning from her travel nursing assignment a week ago. She states that she has a continuous cough, night sweats, and overall feels fatigued. She denies any other symptoms. The nurse practitioner has a PPD placed. What induration finding would be positive for this patient? Is it A 5 millimeter induration, B, a 10 millimeter induration or greater, C, a 15 millimeter induration or greater, or D, a 3 millimeter induration? Take a moment and tell me what you got in the comments. So, you know, I always recommend reading the stem of the question first. So here, the stem of the question states, what induration finding would be positive for this patient? All right, so you know there's a category of people who fall in each induration category that is considered positive for that particular person, patient. So, you know, there's 5 millimeter, 10 millimeter, and 15, right? So this patient is having classic TB symptoms with the cough, night sweats, fatigue, PPD place. But the thing we should really pay attention to is that she is a nurse and she was recently on a travel assignment. It doesn't say where, so we need to consider maybe traveling to certain areas. As you engage more, you want to ask about those specific areas to see if maybe they traveled to a Mediterranean area. But mainly thinking about nurses in those highly populated areas, being around other patients. So 10 millimeter induration is that category they fall into. So if you see a 10 millimeter induration for this type of population, that's considered a positive for the PPD. So B is the best answer here. All right, so the patient returns for 48 hours later for their assessment of the PPD insertion site. Upon examination, the nurse practitioner notes a 10 millimeter induration. What is the next best step by the nurse practitioner? Is it A, to get a chest x-ray and or sputum culture, B, obtain a nasal swab, C, obtain a throat swab, or D, complete a 2-step PPD? Take a moment and tell me what you got in the comments, you guys. All right, so stem of the question here is, what is the next best step by the nurse practitioner? So, all right, we're looking at those results that came in, the induration, like we stated on that nursing patient, was that their induration was 10 millimeters, and that's a positive PPD. So with that being a positive finding, next we want to do our gold standard assessment for TB, which is a chest x-ray and or sputum culture. Now on boards, so your best answer is A, but on boards, they will not give you both. If they do, it will be in this fashion, because you can do a chest x-ray and or a sputum culture as the gold standard to confirm a diagnosis of TB. All right, and lastly, question number 3. All right, so the chest x-ray is positive and the nurse practitioner has diagnosed the patient with active TB. While planning treatment, the nurse practitioner student inquires if TB is a reportable disease. What is the best response by the nurse practitioner? Is it A, latent TB is reportable, not active TB? B, yes, TB is a reportable disease? C, no, TB is not a reportable disease? Or D, it depends if the patient is symptomatic? Take a moment and tell me what you got in the comments, you guys. All right, so similar question here states, what is the best response by the nurse practitioner? So what are we responding to? So the NP student is asking the nurse practitioner if TB is a reportable disease. The answer is B. Yes, TB is a reportable disease. It doesn't matter if it's active, if it's latent, it is a reportable disease, okay? Now, remembering with active and latent phase, latent TB is when, say, the PPD was positive, but then the chest x-ray and sputum culture was not. So they would still require treatment, but the patient is not considered contagious. So they wouldn't have to be quarantined, but it's still reportable. Now, active TB is when, just like the scenario, they're symptomatic, their PPD is positive, the chest x-ray and sputum culture are positive, and then you're doing all 4 steps of the treatment. The INH, the ethambutol, the pyrazidamide, all of your treatment options, okay? The rifampin, and doing all 4, whereas with latent, you do 3 of the 4, right? And so again, with the active, they are positive in all areas. We treat with all 4 for 6 to 9 months. They are contagious. You do quarantine those patients, but in all cases, TB is reportable, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But make sure y'all meet me back here. And if you need any of the resources that I offer, my review book, there's an ebook option as well as a paperback option. Both are linked in the bio of this channel. The self-paced review course designed for family and adult GERO review students preparing for the ANCC as well as AAMP is also linked in the bio of this channel. We are rolling into week 4 of the 5-week group intensive review, so be on the lookout for the next up and coming one if you are looking to join that. One-on-one sessions, I always say reach out either by phone or email, simply because it's so customized for our one-on-one sessions. So you can either do the sessions, the tier where we work on your weaknesses, meaning like, say there's a particular, say like we did TB today. Say you just are really confused with TB, you keep mixing it up and you just want to spend some time making sure you get that down. A lot of people do it for asthma or the non-clinical, etc. If you want to do things like that, that's one tier. If you're just looking to assess your exam readiness to see where you are, see if there's certain areas you need to prepare more on, there is an exam readiness one-on-one assessment. And then lastly is the custom package, saying that maybe you have been unsuccessful before, or maybe you struggle with getting a plan down and staying on track. Well, this is designed to provide you with a pretest initially to gauge where you are, your weaknesses, structure a study plan, work alongside you through that time frame, and then help you to go from unsuccessful to successful, or to hold you accountable to get to a successful attempt, okay? And then, like I mentioned earlier, our practice question review course is July 13th. It's almost here. If you're looking to grab a space there, it is $49. The link is also in the description of this video, so be sure to join while it's still open. It has some spaces available. There are 7 left. All right, you guys. You can call us at 803-400-6864 or shoot a text message to that number. And you can also email the nursing studio, the number 1 at gmail.com. But y'all know what to do. Make sure y'all meet me back here. Happy studying. Bye, y'all.